My name is Shelby Lund, and I will be discussing my project of combined PI3K kinase inhibition and BRD4-targeting PROTAC degradation represents a novel synergistic treatment for lymphoma patients with a TP53 mutation. Diffuse large B-cell lymphoma represents one of the most common cancers affecting over 70,000 Americans yearly. While 50% of patients can experience long-term remission after treatment with standard frontline regimens such as R-CHOP, the other 15% face a dismal 15% 5-year survival rate, made worse by the presence of a TP53 mutation. While many second-line therapies have been introduced over the past decade, the survival rate has not climbed. Targeting master regulator genes responsible for the expression of thousands of genes critical for tumorigenesis has emerged as a novel therapeutic option. One such as BRD4 can be targeted by ARV-825, a PROTAC, which carries a unique mechanism that causes its target to be completely degraded. As a result of BRD4 degradation, upregulation of some genes capable of driving tumorigenesis occurs. One pathway to emerge after ARV-825 treatment are the PI3K pathway genes. PI3K is a signaling pathway that promotes the survival and proliferation of tumor cells through the corruption of typically normal pathways that drive B-cell development. By combining PI3K inhibitors, copanlisib, alongside of ARV-825, can eliminate a key weakness of treatment results. So in figure 1, you can see an illustration showing what a cell line is. A cell line is tumor cells that are taken from a patient with lymphoma and are kept in culture for extended periods of time. The table below that is showing the drug assays that we set up in lab to run these tests. In figure 2, it is showing the overall survival rate of patients with the TP53 mutation and all other patients over a duration of time. Figure 3 is all these figures are showing the different cell lines that we use in showing the percent cell viability versus the concentration of inhibitor used for the 4 different drugs that we use for all cell lines. The heat map in figure 3 is showing the individual EC50 values for each cell line in the 4 different drugs that we use. The EC50 value is the dosage at which 50% of cell death occurred. Figure 4 is showing, the first figure in figure 4 is showing the outcome of BRD4 degradation. It shows the different genes that gain expression and that lose expression as a result of BRD4 inhibition. In green, you can see that the PI3K pathway is one gene that gains expression after the degradation of BRD4, which is why we decided to use copanlisib in combination with ARV for this test. The figure below that shows the relative cell viability in one specific cell line, which was DHL6, for copanlisib and ARV alone, as well as in combination. As you can see, alone, copanlisib only has 60% cell viability with 40% cell viability for ARV-825. When they are used in combination, they represent about a 10% cell viability. So in conclusion, the upregulation of PI3K upon degradation of BRD4 has the potential to be exploited by combining ARV-828 with PI3K inhibitors such as copanlisib.